The cardiac veins are organized into distinct systems, each playing a crucial role in draining deoxygenated blood from the heart muscles back into the circulation. The first system is centered around the coronary sinus, into which the majority of the cardiac veins discharge. Another system comprises veins that bypass the coronary sinus altogether, opting instead to drain directly into the right atrium. This dual system arrangement ensures that the heart efficiently recycles its blood supply. First, we will examine the coronary sinus, which is located on the posterior side of the heart. It runs transversely in the left atrioventricular groove and empties into the right atrium. Its opening is located close to the opening of the inferior vena cava in the right atrium. The first vein we will describe is the great cardiac vein, a major vessel that originates at the apex of the heart, draining the left ventricular apex, the anterior interventricular septum, and the anterior portions of both ventricles. It travels alongside the anterior interventricular artery, part of it known as the anterior interventricular vein, and advances within the left atrioventricular groove next to the left circumflex artery. As it courses along the coronary sulcus on the left side of the heart, the vein gradually enlarges and eventually becomes continuous with the coronary sinus. This transition occurs as the great cardiac vein merges with the left part of the coronary sinus, forming a single pathway that empties into the right upper part of the heart. The anterior interventricular vein, as previously mentioned, starts at the front of the heart and joins up with the great cardiac vein. It runs along a groove on the front of the heart, parallel to the left anterior descending coronary artery. Another vein related to the great cardiac vein is the left marginal vein, which drains the lateral walls of the left ventricle. It ascends toward the great cardiac vein, where it commonly empties. Its exact point of entry can vary. Sometimes it opens into the first part of the coronary sinus, and at other times it connects directly with the great cardiac vein. If we examine the heart more closely towards its inferior surface, we can see a vein that drains a part of the bottom wall of the left ventricle. This is known as the inferior vein of the left ventricle. It usually joins the great cardiac vein, or the coronary sinus, and is located on the back surface of the left ventricle. If we direct our attention towards the left atrium, we can observe a small vessel that collects blood from the left atrium. It typically merges with either the great cardiac vein or the coronary sinus. This vessel is known as the oblique vein of the left atrium, or the oblique vein of Marshall. It also marks a delineation point between the great cardiac vein and the coronary sinus. Examining the heart's inferior aspect, particularly next to the posterior interventricular groove, we can see the middle cardiac vein ascending alongside the inferior interventricular artery and ultimately draining it. Upon inspecting the heart near the right atrium, a group of veins is noticeable. Among these there is one that runs parallel to the right coronary artery in the right atrioventricular groove. This is known as the small cardiac vein. This vein collects blood from both the right ventricle and right atrium. If we direct our attention toward the heart's right margin, we can see a vein that runs alongside the right marginal artery. This is known as the right marginal vein, which closely ascends toward the atrium along the lateral side of the right ventricle. It typically connects with the small cardiac vein. When examining the anterior surface of the heart, it is evident that there is a group of veins which do not empty into the coronary sinus. Instead, they directly empty into the right atrium. These are identified as the anterior cardiac veins. The anterior cardiac veins are a variable group of veins that drain a significant portion of the right ventricle. This concludes our discussion about the coronary veins.